Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Haggitts classification and looking at the polyps containing the cancer with the depth of invasion. So let's look at the diagram. So this will be the adenocarcinoma. Next, on the side, this will be the adenomatous epithelium. Below there is going to be the normal colonic mucosa. And there is also below this there is a muscularis mucosa layer. Then this is the submucosa, S mucosa, that is a submucosa, and below that will be the muscularis propria. So let's partition the divisions. So this will be type 1, type 0, and below the type 0 is level 1, and then comes the level 2 here. This will be level 2. The level 3 will include the stalk. So this is the level 3 up to the muscularis propria. And what is below? The submucosal layer. Around this layer, this will be the type 4. So now let's look into the theory. So there is level 0. So as we saw, level 0, it is the carcinoma, it doesn't invade the muscularis mucosa. So the carcinoma, it does not. So there is no entry, does not invade the muscularis mucosae, and there is a carcinoma in situ or the intramucosal carcinoma. There is carcinoma in situ or the intramucosal carcinoma. Next, there is level 1. Level 1 means the carcinoma, it invades the muscularis mucosa. So it invades the invades to the muscularis mucosa, and this is into the submucosa, but it is limited to the head of the polyp, but it is only limited to the head of the polyp. Then we look at level 2. Level 2 is the carcinoma, it invades the neck of the polyp. So this invades the neck. 2 means it is the neck of the polyp, and this is nothing but the junction between the head and the stalk. So it's a junction between the head and the stalk. Now moving on to the level 3. Level 3 is the carcinoma. It invades any part of the stalk. So it invades the stalk and it is any part. Lastly, we move on to the grade 4. So in terms of the grade 4, there is a carcinoma. So this carcinoma, it invades into the submucosa of the bowel. So it is present in the submucosa and it is of the bowel. So it is into the submucosa of the bowel and they are below the stalk of the polyp. So they remain below the stalk. So they are below the stalk of polyp but above the muscularis propria. And other very important thing is it is above the muscularis propria. To learn and grow daily like this, please do subscribe.